Welcome to Coming Together for Sexual Health. I'm Tammy Kramer, and I'm thrilled to talk with you about the world we are creating by coming together for sexual health. And yes, the pun is intended. My background in thinking holistically about health as a facilitator and a doula helps me talk with our guests about celebrating pleasure, combating stigma, and making sexual health care both more accessible and more inclusive of the communities we serve. We're powered by nationally recognized experts in sexual health at the University of California, San Francisco, and the California Prevention Training Center. All views expressed are those of the person speaking and not of the CAPTC or their employer. Subscribe to get our latest episodes, share with your friends, and leave us a 5-star review to help more people find us. Thank you for coming together for sexual health. In Season 4, we did a mini-series on harm reduction. And this compilation episode, we've put together the first 10 minutes of each of those conversations. Go back and listen to the one that speaks to you. Welcome to Coming Together for Sexual Health, Cochina Rude. So glad to have you here today.
Thank you so much for having me.
Cochina Rude is a Bay Area-based drag queen, harm reduction advocate, and public health worker. She co-hosts the drag show Princess with Lisa Frankenstein at SF Oasis, which I got to see last weekend, where she established a naloxone distribution and overdose prevention education project for LGBT plus nightlife, providing over 2,000 doses of Narcan for community members in San Francisco's South of Market neighborhood since 2021, which is a huge number of doses you've been able to provide to the community, alongside the other educational work you've done, which I look forward to diving into. And this interview is the first of a 3-part series we're doing on the connections between harm reduction and sexual health. And I just want to say a little bit about why we're spending so much time on harm reduction on a sexual health podcast for our listeners. So these issues are interconnected on many levels, and I'm going to share a couple, and I'm sure more will come forward. We want to look at the whole person and knowing and understanding that issues of substance use and sexual health impact a lot of the same communities that experience inequity and stigma. So communities including queer people, people of color, and sex workers that are dealing with issues of, like I said, stigma, disproportionate numbers of infections, sometimes lack of access to treatment, and issues of policing and incarceration. Another kind of connection we have is that harm reduction is a grassroots movement. It grew out of a community of people who use substances and those who love them to non-judgmentally support folks who use substances and provide resources, and to help people basically make the choices that are most aligned with what their own personal goals are. And we'll hear more from Cochina soon about your definition, and I look forward to adding to that. And this philosophy is something that's also since been applied to other areas of life. And sexual health is one of those areas of how can we support folks when it comes to making choices around their sexual health. And last, I just want to say that for us at this podcast, we're really focused on reaching providers, reaching advocates, and a lot of the places where people seek treatment around sexual health are also those same places where people could go to get treatment around harm reduction with substance use. We've discussed harm reduction on previous seasons. Look for that episode on sex, drugs, and rock and roll with Jen Jackson. So one last piece of introduction here is that for this series of 3, we're going to be using the ecological model, and we're going to be moving from the individual personal level to the interpersonal or social level, and then finally to the contextual and structural level. Of course, all 3 of these, the personal, social, and structural, are interconnected and inseparable in many ways. But to give us a little bit of a framing, today we're going to be starting with that individual or personal level, given that, Cochina, you have been working on these issues from a very personal place and incorporating it into your platform as a performer. I had a great time at Princess this last Saturday. It was super fun. The crowd was really awesome. Just really good vibes. Your co-host and the performers were on point. How was the show for you this last Saturday?
The show last Saturday was fantastic, and thanks again for coming. This is what we do every single week. Often these shows are fabulous and a bit of a blur, and sometimes I don't remember what happened at what show or, but the crowd was really great last week. Our guest performer was phenomenal, and I just have such a great time on stage with my co-host, Lisa Frankenstein. We're known to be something of a pair with each other. And so it's great to have that connection and rapport with another person and provide that kind of dynamic hosting style. I think that it keeps the audience engaged rather than just having me up there shaking my fist about harm reduction to people, and it's nice to have some levity.
Can you describe a bit about your style as a drag queen?
My drag is inspired by other people who were touchstones in my life. I would describe my drag as DIY, Chicanx or Chicana, Chicano. I identify as a indigenous Californian. Growing up, I was inspired by the Latina Chola girls, the Pachuca girls, the really sharp eyeliner and eyebrows and lip liner and bad attitudes, walking the mile in PE class, and punk rock chicks as well. Those two types of women who I was around when I was a teenager just really inspired me because they were tough, they were strong. Hard femme is how I would describe it. Just really playing with that idea of like looking really kind of pretty, but having a really tough edge to it. The DIY aspect is I sometimes use unconventional materials. I make drag my own way. So DIY for me means not just the literal sense of building and creating things from scratch, but also the positive mental attitude of, you can do anything yourself. And that's something that is at the heart of what it means to be a part of the punk community.
Yeah, I'm just reflecting on how that also might show up in how you advocate for harm reduction in your work as a drag queen.
I say this all the time. When I started doing harm reduction work as a drag queen, I didn't ask permission from anybody, except for, of course, Darcy Drollinger, who's the owner of SF Oasis, which is where the show occurs. I just was a trainer and distributor for the San Francisco Dope Project, which is an amazing organization. It's part of the National Harm Reduction Coalition. I just had the idea one day to start giving Narcan to people. I didn't check in with the health department. I didn't check in with like any other organizations that were doing harm reduction work. I just saw a need that was not being addressed among my community. So I just decided to do it. I made it up as I went. I'm not a nonprofit. I'm not an organization. I'm just a person. And I had resources to provide harm reduction education and literally like Narcan and fentanyl test strips to partygoers. And so I'm committed to that.
I'd love to hear a bit about that personal aspect of how you came to working around harm reduction.
Sure. I started working in harm reduction about 10 years ago. I was an intern at a HIV and AIDS nonprofit in Sonoma County, actually called Face to Face. They still exist. I think they do fabulous work. So I was an HIV test counselor, a test counselor for Hep C as well. I would test participants who may be experiencing homelessness, people who use drugs. I also tested people for HIV and Hep C in the local jail, and so really just had that experience working with community members who are historically disenfranchised or not treated very well by the society and the world that we live in. As a teenager growing up in Sonoma County, I was a drug user and truant and all these things. And, I managed to graduate with a bachelor's in sociology and women's and gender studies from Sonoma State University, but I always kind of disidentified with the way that the world told me to do things. And so I always felt like I should do things on my own terms in my own way.
I'm wondering if you can share with us about a time that you really realized how critical this work is.
When I was a teenager, I was gay, person of color. I didn't really have resources for my own sexual health. The answers that I was looking for weren't really available to me. Mind you, this wasn't even that long ago. This is in the early mid 2000s. And I didn't have a lot of queer people to look up to who were role models. I have a great relationship with my family and my parents, but I just don't think that they had the resources available to them to be able to provide the help that I needed. But I want to say junior year of high school, I went to a local free clinic for teenagers and young adults. It was my first time getting tested for STIs without my parents knowing. I thought I had a STD, and the physician molested me during my tests. And so since then, I am committed to making sure that people don't experience that because I was taken advantage of by someone. And
Wow.
fortunately, I was able to advocate for myself in that scenario. It took me many years to kind of look back and realize that that's what really had happened. And I became an HIV test counselor for the purpose of ensuring that that wouldn't happen to people. So I came into doing harm reduction work related to sexual health. My understanding of how harm reduction and drug use and sexual expression all kind of mixed together. And I managed a sexual health program at St. James Infirmary, which is a nonprofit in San Francisco by and for sex workers. It's the only one in the country that's a peer run clinic for people who engage in sex work. And I oversaw the HIV, Hep C, chlamydia, gonorrhea, syphilis testing and outreach. Through that work, I became familiar with overdose prevention and drug stuff. I worked at the needle exchange every week. I talked to people who injected drugs, people experiencing homelessness, and I learned a lot. And that is something that I've been able to take with me in my work today.
Wow. Just gonna hold space for all of that. Thank you for sharing your experience. And it's incredible to also take that experience and then utilize the motivation to create a better reality for other people. Welcome to Coming Together for Sexual Health, Bronze Courtney. I'm so excited to get to connect with you today. I just want to extend a warm welcome before we jump in here.
Thank you for having me.
And, this is our second of a 3-part series that we're doing on harm reduction at the top of season 4. So I just want to share that we're moving through the ecological model, moving from the individual, which we focused on last episode with self-proclaimed Narcan queen Cochina Rude. So definitely listen to that if you haven't yet, folks. And today we're going to be focusing on the organizational and the social level. Next episode, we'll be focusing on the structural level. Today, we've got Bronze Courtney, who has been working in public health as a harm reductionist for 20 years. He's currently the executive director of HEPPAC, which serves the Contra Costa and Alameda communities. His field of expertise include working with people who use drugs, unhoused homeless folks, LGBTQ folks, youth, and reentry. So, Bronze, I know you've been traveling. So welcome back to the Bay. What have you been up to?
Well, went to the RX and illicit drug summit in Atlanta, which talked kind of openly around illicit drugs and prevention and care and treatment and services that are going on nationally. A big topic they were talking about was the safer consumption space, which was the highlight of the conference for me, where Sam Rivera, who is the executive director of On Point in New York, which is the only authorized safer consumption space in our country, spoke about the normalization of safer consumption spaces. And so, we're watching New York very closely because that's going to be like the beacon of like, look what New York's doing, right?
Can you explain what safer consumption spaces are?
Safer consumption spaces, they used to be called safer injection sites, overdose prevention sites. It's a place where people can come and use their drugs and have a safe, sterile space to do that. That's overseen by specific staff and nurses, because there's folks who are out here in the street. We do syringe exchange and we're like, hey, exchange your used syringes for sterile syringes. But then folks have to go into their encampments where it's unsterile and inject, right? And then they got to go into the street where people are like, oh my God, it's public drug use. So we want to welcome people into a space where they can like woosah. They're not trying to rush that fix. They're not trying to rush that hit because the police are coming or whatever the case may be. And then also getting access to literally just basic need like shower, laundry, food, before we even start talking about getting folks into overdose prevention or drug treatment at these sites. And they actually already exist. They've been existing for like decades. They're called bars, where people, go in and have a drink in a dedicated space that has sterile equipment for you to drink your alcohol.
Absolutely. And it really leads nicely into this next question I wanted to ask you, which was, how do you define harm reduction and how does it relate to sexual health?
Harm reduction basically is a set of practices to reduce the harm without necessarily stopping the behavior. So if people are having a lot of sex, whether that's through the flesh trade, they have sex addictions, or whatever the case may be, what are you doing in that activity to keep yourself safer, to reduce the harm, right? We're not saying stopping having sex, because sex is a wonderful thing, right? Without sex, you nor I would be here. But what is the harm that's occurring during this sexual behavior, and how do you reduce that? And so in organizations like HEPAC, we're really open to the ambivalence. What's great about your drugs, right? Let's talk openly about what the wonderful things about it do for you, right? And then we talk about what are the harms within those behaviors and how do you reduce those harms without stopping the entire behavior.
I love that definition. What are the harms and how can you keep getting the value that you get out of it for yourself? I'd love to hear a bit about your personal story and what led you to do work around harm reduction.
I've been doing harm reduction longer than I even knew what harm reduction was. I grew up with a single mother. Father was absent. He was an addict in his chaotic stage of drug use. Mother was in and out of recovery growing up. And I always had this one memory of what I thought harm reduction was as a child. My mom was a severe alcoholic and used uppers, cocaine, and all that other stuff. And I would see her drink and drink and drink and drink. I remember I used to pour her vodka out of her bottle and replace it with water and put it back in her hiding spot. As like 5, 6 years old, I don't understand addiction and all that around. I just know my mom is continuing to do something to hurt herself. And she's all that I've got. And then another time, I basically just dropped a dime on my mom. I snitched her out to my grandparents. Thank God for nanas. Anybody who has a nana or a grandparent, that was the responsible person at that time who helped raise me because my mom was like in and out of jail and in her addiction where it almost seemed like she was a sibling versus a parent at that point. She always loved me and did the best that she could, but it was always making sure that Nana knew what was going on so she could check my mama. And then what got me into the field of harm reduction was I was working in Home Depot and somebody kind of poached me out of Home Depot and was like, "Oh, you've got great people person skills. Have you ever thought about doing outreach?" And I was, like, well, what the hell is outreach? And they were like, "Oh, you talk about sex and drugs and you get people to come take HIV tests." I was like, "What? They pay people to talk about sex and drugs? What? I'm making $15 an hour at that moment. Can you match that?" They were like, "We'll pay you $16." So started working for this agency called AMASI, which stood for African American AIDS Support Survival Institute Incorporated, which was the first gay Black organization in Oakland, California, as the epidemic was rising in the Black community, specifically men who have sex with men, injection drug user, and just the Black community in general. And so they hired me as a outreach worker, which I didn't even know what that meant until I got there. And they were like, "So you're going to go into this club and look cute and take your shirt off and dance on this thing out on a box and twerk and work it out and jack on the box." They just call it jacking on the box, right? And just dance and just live it up. And you're going to get people to come talk to you. And then you're going to forward them to this table over here with the condoms and the information about HIV. And then the other part of your job is to go into the streets, and they had me in the public sex environment, Lake Merritt Park, at like 2 in the morning. And so this was a whole new world for me. And as a young bisexual kid coming from the city and going into Oakland, which they call the town, it was a wild time.
I can imagine. I'd love to hear what you later learned in retrospect about the connection with your mom growing up and ways that people can support those that they love who are using.
It's so funny. I remember my mom used to say, "I have a disease. I have a disease." I was like, "F this disease. Am I not worth you stopping using drugs?" Right? Like, just stop. Right? I didn't understand that people use drugs for a variety of different reasons, whether it's to feel good, to mask emotional, physical pain. And so, whatever the story is, which got my mother using drugs and abusing drugs, I started to have more empathy for what she was going through and that it is a disease and that we have to really practice harm reduction, as my mother was probably my biggest participant client and still is because she's in recovery, right? And recovery looks different for people. My mother may never stop drugs completely, and that's cool with me. We can openly have dialogue around drug use. We can talk about the old stories of the bar fights and her in and out of jail. And she's like, "Oh, look at me now. Like, this is my little weekend thing. I have my little couple shots and sit there and we binge watch HGTV." And I'm glad that now she's living a healthier life.
Yeah, I'm really hearing how different those standpoints are of trying to control or shame or prevent use versus being curious, asking questions, providing support, coming from a place of love. And on that, why don't we transition into HEPAC? Can you tell us what does HEPAC stand for? What does HEPAC do? And you've been there for 15 years, right? So what's been keeping you at HEPAC too?
HEPAC stands for the HIV Education Prevention Project of Alameda County. I felt like I was really good in this field, relating to our population. I was already kind of like moving up within the ranks and making a name for myself within the field. And so I walked in and I had just been in a domestic violence situation with my boyfriend at the time. I'm like, oh, great. I'm going to go into Het Pack. They're going to be like, sorry, bro, we're not looking for that. But come to find out, Het Pack don't give a shit about none of that, right? They're like, we're from the streets. We work with active injection drug users. We see and hear about domestic violence a lot. So they liked me and hired me as an outreach worker and just started getting into it and realizing like, whoa, okay, there's a lot going on in these streets other than just the risk factors around sex. It was around drug use. And so I came from a family who they did a lot coke, crack, alcohol, pills, things like that. But I wasn't really familiar with the injection drug using community, which they now call people who inject drugs. So even PC terms have changed, right? Because injection drug user is saying like that's all that you are. But before all of that, you're a person. And that's what HepPac's bread and butter was, right? They were an agency that kind of pioneered syringe access, overdose prevention in East Oakland when the HIV epidemic was killing Black folks, specifically Black folks who inject drugs in the East Bay. And so I really quickly started to see, like, whoa, is this shit even legal, what we're doing? Because before it was legal, they were called ACE, Alameda County Exchange. This is when HepPac was underground and not an actual 501c3 nonprofit agency who were just like renegade Black and brown folk out here using their own money and resources to make sure that Black and brown folk had access to sterile syringes and drug using equipment when it was illegal. And so our forefathers, who is some of our ex board, were getting arrested because it was considered a civil disobedience and illegal to do syringe exchange in the city of Oakland. And they had to go to the board of supervisors every 2 weeks and declare this state of emergency. It was like, how many times do we need to come up here for years before you get the clue that Black and brown people are dying and getting HIV and Hep C, to where they were like, we're so tired of seeing y'all ACE people, like, it's standing order. Syringe exchange is legal. They literally helped pioneer that in East Oakland with help from agencies like CalPEP and folks in San Francisco, making sure that our Black and brown people had equitable access to things that keep them healthy, alive, and able to thrive. And so through all that, we legitimized ourselves to a 501c3 through a track of HIV funds, hence the name HIV Education Prevention Project of Alameda County. We continuously are seeking more funds to expand services because, like, we are in the city of dope, and they call it the city of dope for a reason. We're one of the third largest ports in the United States of America. There's a lot of dope that comes in and out of our ports. Crack cocaine, heroin killed our Black community and is just starting to like resurrect and start to show face of it healing, but it killed our community. And HepPac was in here trying to make sure that our folks were not dying.
Wow, that was so much critical context for the work that HepPac is doing in terms of the impact on Black and Brown communities in the Bay Area. And like you said, based on that really felt need of the community to serve each other. I'm wondering if you can give us an overview of some of the highlights of what HepPac is doing now. How would you describe the services that HepPac is offering today?
I can describe the services that HepPac offers today as an integrated service medical model. We love to say that we're like a one stop shop. So, for example, we were county funded to do overdose prevention, education, naloxone distribution, which is called the OPENed program, which is loosely modeled from the DOPE project in San Francisco. So, big ups to the DOPE project in Frisco. We are training folks in the tents who are actually using to identify what an opioid overdose looks like, give them the training, give them the actual product, which is Narcan, to bring people up out of it. And then we also train service providers who also work with that community. And then we train larger institutions. So down from like we up in the tents to like corporate institutions who are like, guess what? Fentanyl's on the scene and people are at risk. It's not just these folks in the tent shooting dope who are homeless who are at risk for overdose. Now it's anybody and everybody. It sucks kind of because when Black folks was over here dying for overdose, wasn't nobody giving a shit. But when other folks started dying and folks who weren't the typical face of what overdose looked like, then all the money started rolling out. But at that point, we had already made relationships with the board of supervisors, say, hey, we're HepPac. You don't give us not a dime to do this work, but we are very resourceful. We're hoarding and getting supplies from other agencies. And Chicago Recovery Alliance back in the day, Dan Big, rest in peace, used to help us smuggle Narcan from Chicago to Oakland so that we can have Narcan for our programs. And so when there was this national push for overdose prevention, Board of Supervisors, Alameda County was like, oh, snap, like we're seeing this happening nationally. We're seeing it happening in the Black community and other communities, and we need to like do something about it. Oh, where's that Hep Pack place? They does this, right? Let's call them to the table. And that's what happened. The money showed up to do a pilot project to address overdose specifically for the Black and Brown community. Let's give you some resources. So we created this program called Opened, which allowed us to expand. And this pilot project, which was only supposed to happen for like a couple years, is now in its 6th year, normalizing the conversation around overdose prevention, education, naloxone distribution in all kinds of different settings, and creating access to Narcan. And now that they have nasal Narcan, it's a lot more user friendly and digestible. So even though, the whole overdose crisis kind of got gentrified, it allowed us to expand the conversation to be like, guess what? It's not just these typical folks you had thought were just at risk for opioid overdose, but it is all of us at risk for opioid overdose, right? If you're popping pills or you're on lean or you've broken arm and now you're popping Vicodins left and right, your doctor cuts your prescription and now you're in the streets getting some kind of other, you're at risk as well. Little old white ladies are at risk. We need to educate as many people as possible and normalize the conversation to carry Narcan on you and be trained in opioid overdose response.
Welcome to Coming Together for Sexual Health. I'm so glad to have you, Tanagra.
Thank you for having me. I'm excited to be in conversation with you.
And for our listeners, this is the third of a 3-part series that we're doing for season 4 on harm reduction. And today we're going to be focusing on the third rung of the ecological model. So we started with the individual or the personal level, and then we went to the organizational level. And today we're going to be talking about structures and policies, both within the US and globally. And for the discussion today, I'm so excited to have Tanagra Melgarejo Pulida with us, who is the National Learning and Engagement Strategist for the National Harm Reduction Coalition, which we'll be learning about during this interview. Tanagra was born and raised in Puerto Rico and is the proud daughter of Mexican and Cuban immigrants. Through her position at the National Harm Reduction Coalition, she leads the organization's capacity building and technical assistance efforts across the U.S. and its territories. Tanagra holds an MSW from the University of Puerto Rico and is certified as both an abortion and death doula, as well as grief counselor. Wow, there are so many conversations I wish we could have today. But just want to get started with what got you interested in working around harm reduction?
So I have always been someone who has been really connected to issues of justice and injustice. And going to the university, I felt like I wanted to be involved in social justice. And I wanted to figure out ways in which we, together as a collective and individually, can change the world, right? To make it better, more loving, more kind for all of us. And so through wandering around different spaces, I came across drug user health and HIV prevention. And I realized that those spaces for me held the key to really working towards transformation, because what is good for people who use drugs is good for all of us. And also because when we're thinking about people who use drugs, to me, they're one of the communities that hold most power and also are the most invisibilized, shamed, dehumanized, and stigmatized. And so for me, like, I felt that was a space in which I could come in to provide support, to learn also, and to figure out ways in which I could build a movement or be part of that movement with people who were already doing that work. So all of those things got me interested in harm reduction. And ultimately, because it's really smart, it makes sense, it's common sense. So why not do something that makes sense? Why continue to harm people when we can actually love them back to health and we can work with them and support them and learn from them?
That makes me really interested in hearing how you define harm reduction.
Harm reduction to me, it's love. It is unconditional love. It is love that is not tied to any outcome. It is a love that asks us to be humble. It is a love that asks us to listen. It is a love that asks us also to look at ourselves and really recognize or go down deep in those places that we normally don't look into. to look at the ways in which we may be creating barriers for that love. Harm reduction is about loving ourselves and building community.
That's such a beautiful definition to really think about harm reduction as a way of expressing unconditional love. So, you shared a bit about your background in terms of growing up in Puerto Rico and your immigration story, and I'd love to hear how your personal experiences have impacted your commitment to harm reduction.
I have family that has been impacted by the war on drugs directly. I had an uncle who was in Miami in the height of the 80s cocaine trade, and he worked at an airport for a major airline at the time, and he was a bagger. And so he was connected to a group of people at the airport that had information when flights were coming in and which bags they could like move through, and he would get paid because he needed money. And so he started doing that, and at some point the federal government caught wind of that. And so of all the people that were involved in that, the few people who were baggers that actually were the ones that were not making the most in the whole scheme were brought to trial, and he was incarcerated for several years because of that. And I also have had family members that have had at some points problematic relationships with substances. And so I've seen communities that I love here in Puerto Rico be very much impacted by the war on drugs. People that I care about that live in public housing live under the constant threat of intervention from the National Guard and the police. And you feel it, right? You know, as a colony, when the United States gets a cough or a cold, we get double pneumonia or triple pneumonia if that's possible. And so I think the impacts of the war on drugs, we feel them here much more profoundly in many ways too.
I'm interested in hearing about the moment or a moment where you realized that harm reduction was the way you wanted to do this work.
I started my journey in Western Massachusetts, right? Or harm reduction found me there. I was working for a small HIV prevention organization that works with Puerto Rican folks that have migrated or were immigrants in the United States. And so we applied to attend a conference. And I remember that one of the keynote speakers was this amazing human being named Edith Springer. And Edith Springer is one of the mothers of harm reduction in this country. Edith went to the United Kingdom. She went to Liverpool, which is the home of harm reduction as we know it. At Merseyside, she visited that community. She also went to the Netherlands, which is another really important place for the birth of harm reduction. And she brought that back to the United States. She brought together a group of people that we name the Harm Reduction Working Group. And that group of folks were both academics, community activists. Dave Purchase was there, Imani Woods was there, Dan Big was part of that. A lot of folks that have been really important got together in the midst of the HIV/AIDS crisis. And out of that, the harm reduction movement in the United States, as we know it, was born. And so listening to Edith speak, I realized, you know, why are we not doing this? It resonated with me. It was like, I cannot move through the world now without moving through the world with this ethos and this practice. And so when we came back to Massachusetts, we were really excited. And we told the director of the organization, we need to bring the Harm Reduction Coalition to train us. We were actually able to bring her. And then the state of Massachusetts, the Department of Public Health also brought her. And all the programs across the state had the opportunity to start connecting to harm reduction.
Incredible how we can be inspired by those moments and carry them with us, these like turning points that we can't necessarily predict or even recognize in the moment, how much of a shift it's creating in us. Thanks for listening, and please follow and rate us wherever you get your podcasts to help more people find us. And hey, how about sharing this with a friend or a colleague you'd like to talk with about sexual health? Check out the show notes for the resources mentioned in this episode and the transcript of the show. Connect with us on Instagram at Coming Together Pod, on X at California PTC, and at comingtogetherpod.com. This podcast is produced by me, Tammy Kramer, with our editor and co-producer, Isaiah Ashburn. We're based at the University of California, San Francisco, and would like to acknowledge the Ramaytush Ohlone people, the traditional custodians of the land that UCSF sits upon. Thank you for coming together for sexual health.